Hi everyone, today we're going to be talking about the care environment as part of a framework to deliver person-centred care. We'll also be discussing person-centred workplace cultures. There's a lot to cover, but don't worry, we'll be guiding you through it step by step. Let's begin. Person-centred care is essentially medical care that remembers that we're treating a person, not a disease. Things like taking into account a patient's rights, needs and wants, and treating them as an equal partner in the healthcare process. Person-centred care is based on values of kindness, compassion, respect, trust, and recognition. Person-centred workplaces are essentially just those that enable person-centred care, and really truly embody person-centred principles more than just lip service. An important distinction to make here is that person-centred workplaces are talking about patient needs and also about the needs of staff. We can't forget that staff are people too and have needs as well. So why are we spending so much time talking about person-centred care? Simply, it's part of being a nurse. The Nursing and Midwifery Board of Australia outlines standards of practice that we must abide by for our registration purposes, and those include providing person-centred care. From a patient perspective, person-centred care is about providing the best care possible for a patient at a time of great vulnerability. And person-centred workplace culture means providing a supportive work environment so that we can provide the best possible care. McCormick and McCants have developed a framework identifying factors that can support or inhibit person-centred care. This includes the prerequisites of the nurse as a professional, the care environment as the context in which they deliver care, and the processes by which that care is delivered. Today we're just going to be focusing on the care environment. Composed of an appropriate skill mix, shared decision-making systems, effective staff relationships, supportive organisational systems, power sharing, the potential for innovation and risk-taking, and the physical environment. Let's start with an appropriate skill mix, primarily referring to the professionals making up the medical team. This could be physicians, nurses, and allied health, and when it comes to nurses, you have registered nurses, enrolled nurses, assistants in nursing, and nurse practitioners. It takes many types of health professional to make the healthcare environment work. And from a nursing perspective, it takes many types of nurses to provide the best care. Beyond the makeup of the healthcare team, the skill mix also refers to having enough appropriately skilled staff available to manage the needs of patients, commonly known as patient-nurse ratios. For example, at the Princess Alexandria Hospital, the current nurse ratio in medical surgical is 1 nurse for 4 patients. But in intensive care, it might be 1 nurse to 1 patient. Like in any job, when there aren't enough staff to manage the workload, it increases stress and burnout, leading to a decreased quality of patient care. We also need to give attention to emotional and relationship skills in a healthcare environment, typically undervalued by professionals, but very important to our patients. Patients tend to assume that healthcare staff will have all the necessary technical skills, and as such, they value relationship skills in their interactions with the treating team. The primary challenge in getting an effective skill mix is similar to most businesses, that is, labour cost. Nurses make up a large part of the workforce, and nurse wages are a considerable cost for healthcare. All the while, patient ratios must be maintained to ensure their safety. Additionally, we need to remember the importance of emotional and relationship skills beyond just technical skill.
Shared decision-making systems are important in the care environment. Nurses are responsible for educating patients and ensuring they are making informed decisions about their healthcare. The approach to making the final decision can make the difference in the patient's experience of the healthcare system and help nurses with the delivery of safe, quality healthcare. A shared decision-making system is preferred in the modern-day health setting when discussing patients' healthcare options. The shared decision-making system allows a patient to feel empowered and respected by being actively involved in their own healthcare decisions with their healthcare provider. It acknowledges the patient's preferences and allows for informed decisions from the patient. The most effective tools to support shared decision-making is the use of patient decision aids. They provide information to patients in a way they may find easier to understand. These may include DVDs, brochures, and internet sources. The use of decision aids have been associated with an improvement in communication, knowledge, and patient involvement. Information provided through decision aids can inform the patient about the risks and benefits about their treatment and encourages the patient to decide whether they need to seek further information or additional consultation. Shared decision-making is important in modern-day healthcare. However, for a variety of reasons, its implementation has not been without difficulty. It is important that evidence-based medicine is used for decision-making, and that the use of decision aids support shared decision-making, especially where personal values and preferences are sensitive.
Staff relationships are a key part of any workplace environment. And keeping in the theme of person-centered care, McCormick and McCants noted that we shouldn't just be paying attention to the relationships we have with our patients, but with each other as professionals. Although staff may not necessarily always agree, it's important that their workplace encourages a culture of psychological safety, both for patients and staff. This means that both patients and staff are free to express their needs without fear of retribution. By supporting each other, nurses are better enabled and have lower levels of stress, leading to a healthier workplace culture and better care provided to patients. It's important to note that nursing as a caring profession should involve protecting the dignity of others, and again, that's both staff and patients. A practice initiative in this space is the Burford model of nursing, developed in Burford, Oxfordshire, England. It's a shared philosophy of practice, that is, a way of working, that's developed by nursing staff of a team for nursing staff. Every nurse in the team gets a say in how they want to work, and as the team makeup changes, say as staff change roles, the philosophy is revised, changes to accommodate current needs. Challenges in creating effective staff relationships are similar to those for other factors of the care environment, such as high stress. Horizontal violence is directly opposing effective staff relationships, otherwise known as workplace bullying. We'll cover this in greater detail later, but it's something that typically happens when senior nurse frustration at unfair systems or work situations is redirected at junior staff, causing a breakdown in workplace relationships. Effective staff relationships are also impacted by organisational systems. Supportive organisations are typically identified based on their trust of nursing care, meaning they trust nurses to make clinical decisions, be autonomous, and support each other professionally. When nurses feel supported, they're better able to provide effective patient care. Other practices that can support or inhibit nursing care can include the use of power, especially in the decision-making process, workplace flexibility when it comes to new ideas, and things like how feedback is given. If nurses want to try new techniques, like primary or team nursing, they will need the support of their organisation to do so. When there is conflict between teams, workplaces need an effective dispute resolution process to prevent the breakdown of an effective staff relationship. A practice initiative for this aspect of the care environment is Magnet Hospital accreditation. Magnet hospitals are recognised as leaders when it comes to supporting nursing practice, again by encouraging autonomy and clinical decision-making, so named because they act as magnets for nursing staff, increasing job satisfaction and staff retention. Notably, studies have shown that hospitals with magnet recognition tend to have better patient outcomes, highlighting the importance that person-centered culture has on both staff and patients. Organisational practice challenges are much broader, as due to cost and time restraints, changing organisational practice can be quite difficult. When it comes to having a supportive workplace, there's an increased importance placed on good leadership, as an effective leader can maximise the benefits of supportive organisational structures and minimise the negative impact of unsupportive organisational structures.
The concept of power sharing is important to consider when developing shared decision-making and person-centered practice. The idea challenges the stereotypical hierarchical model of nursing by achieving the best mutually agreed outcomes through agreed values, goals, wishes, and desires. The concept allows staff to exercise their power whilst also being able to negotiate this power in relationships with others, including patients and their families. One of the biggest challenges to power sharing is horizontal violence within the nursing profession. Causes for horizontal violence include task/time imperatives, causing conflict if the tasks aren't completed within the allocated time, generational and hierarchical abuse, which stems from the belief that because senior nurses experience horizontal violence, they now have the right to do the same to junior staff, clique formation, resulting in withdrawal from meaningful interactions within the larger group, low self-esteem, aggression breeding aggression, which is where aggression is reinforced because it has been seen as getting results, and actor-observer effects, which is the justification of our own behaviours by factors out of our control, whilst judging others' behaviour as a result of their personal shortcomings. A good example of power sharing within a healthcare environment is the development of the shared governance model by a nurse unit manager within Alabama. The model was designed to increase participation and autonomy amongst all staff. The most significant goal developed in this model was the appointment of charge nurses from volunteer RNs to assist staff in the transition to shared governance. Interdepartmental meetings were held monthly, and with the advocacy of nurses through their charge nurses, this resulted in enhanced organisational involvement and commitment.
So there's a potential for innovation and risk-taking in the care environment. McCormack and McCants define innovation and risk-taking as the exercising of professional accountability in decision-making that reflects a balance between the best available evidence, professional judgment, local information, and patient and family preferences. Professional autonomy is an important aspect of nursing practice, and it's imperative that nurses are facilitated in working autonomously to allow for this innovation and risk-taking. Autonomy is the independence, initiative, and freedom that we have in the workplace and in our role as registered nurses. There are 4 processes that form the foundation of innovation and risk-taking. 1. The facilitation of decision-making through information sharing and the integration of new information into established perspectives and care practices. 2. The recognition of importance of individual values for decision-making and of knowing how each person's values influence the decisions made. 3. The making explicit of intentions and motivations for action and the boundaries within which care decisions are set. 4. The creation of a culture of care that values the views of the patient as a legitimate basis for decision-making, whilst recognizing that the older person does not always need to be the final attributor of decisions. These processes are reliant on access to the best available evidence to support nursing practice and the decision-making processes. They are also reliant on the development of therapeutic relationships as part of patient-centered care, working with the patient and their family to identify needs and preferences and support decision-making with available evidence and professional judgment. The key leadership challenges for innovation and risk-taking is the support from the nurses in the work environment, the support for nurses to work autonomously in a psychologically safe work environment in a non-judgmental manner, where they're accessing the best available evidence to support their decisions and where they are provided with assistance where needed. Nightingale was a pioneer for nurse-led innovation and initiative. She forged the basis of many nursing practices we have today, such as hand hygiene. In 2016, the Gillette Children's Orthopedic and Surgical Unit implemented a nursing innovation of using magnetic signs for the delivery of visual and family-friendly medication education. These signs show the name, purpose, and side effects of the medication and prompt a dialogue between the families and the healthcare team. 89% of families said this innovation helped to improve their knowledge and awareness of side effects. This innovation ensures that parents are aware of the medications they will be administering to their children when they are discharged home and provides more knowledge and insight into their child's care. This innovation is now being implemented throughout the hospital and in time will likely be seen across the country. The physical environment relates to the things we see, smell, taste, and touch in the nursing environment. Drab clinical environments in the hospital do not promote healing, nurturing care, or belonging, nor do they support a person-centered approach to healthcare. Recently, we have seen an increase in the development and renovation of healthcare facilities, taking into consideration the aesthetics of the environment. The use of art, light, sound, and smells can activate sensory and emotional engagement, promote relaxation, and can lower patient anxiety levels. This can have a host of benefits on the patient's well-being. Research has shown the link between distraction therapy and the reduction of acute and chronic pain levels, especially with children. More than just aesthetics, the physical environment relates to the cleanliness of the environment and access to functional equipment, which both have a direct impact on patient recovery and well-being. Lack of access to clean facilities and equipment will see an increase in hospital-acquired infections. A lack of access to functional equipment will compromise the level and quality of care provided to the patient. It also relates to the general functionality of the environment, such as signage to direct patients and visitors, and the ease of access to patients and facilities for nurses on the wards. The key challenges faced when considering the physical environment are the costs and access to funding in order to implement any required changes, such as renovations or the purchasing of additional equipment. So that concludes the care environment. We hope you enjoyed our presentation.